Welcome to the seventh Executive Leadership Council Business Brief. I'm Mike Hyder, President and CEO of the Executive Leadership Council. Given the year that we've had with the pandemic and being close to the holidays with the stress and anxiety some may be feeling about not being with family, or stress from job loss and financial insecurity due to the economic downturn, or finally, being reunited with family as international travel restrictions have been lifted, it's fair to say that one's mental health has been greatly impacted. What is mental health, you might be asking? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. And mental health problems in the United States affect all races, ethnicities, and cultures. However, these issues disproportionately affect Black Americans. And according to WebMD, an article with WebMD, Black people are also less likely than white people to seek and receive the treatment that they need. In fact, WebMD statistics show that Black Americans are more likely than white Americans to wrestle with depression. Yet, fewer than 10% of the Black Americans get mental health counseling or treatment, compared with more than 18% of white Americans. Here to discuss these issues around mental health and to take a deeper dive is none other than Dr. Janet Taylor, psychiatrist and author of The Courageous Classroom, Creating a Culture of Safety for Students to Learn and Thrive. I'm so excited to be here with you. Welcome, Dr. Taylor, or I should say, Dr. Janet, welcome.
That's right. Thank you so much, Mike. How are you?
I'm great, thank you. And I'm so excited and happy that you were here, especially to help address a very, very important topic for us. So let's get right to it, shall we? For the past 20 months or so, we've been going through something with this pandemic, as you well know. And whether it's the toll of social distancing from our loved ones, or the challenges that come with our, job security or job loss, which impacts one's financial security and even our physical health, these issues can certainly impact one's mental health. However, Dr. Janet, what is the most important factor that we should realize about mental health?
Well, Mike, as you mentioned, mental health, your brain is in your body. So nearly 50% of all Americans have one diagnosable mental condition. It doesn't necessarily mean mental illness like depression or bipolar disorder or schizophrenia, but we all are going through something. And I think it's really important to understand that our mental health certainly is impacted by factors as Black people in particular, by factors like chronic racism, discrimination, trauma, and all of those things that can impact so many of us. But when you look at numbers of mental health conditions, it's not all Black people have higher numbers. Certainly what's happened is that because of the long history of racism and bias in medicine, in particular with issues like depression, Black people still are less likely to be offered psychotherapy or talk therapy, offered antidepressants. And so that is an area that certainly with cultural humility, cultural competence, we are trying to bridge that gap. But the reality is all of us should be aware and concerned about how our brain is functioning during these times. And so as your initial question was, what is mental health? Mental health is our ability to love, to work, to communicate, to be in relationship with, and talk about those issues that certainly impact our overall functioning. And as the World Health Organization says, there's no physical health without mental health. So we are all one, our brain and body are connected. And there's never been a more important time to completely be aware of how you're thinking, feeling, and acting.
Wow. So let me expand a little bit on what you just said and ask, how does stress, since you talked about stress, how does stress impact physical and emotional health?
Stress is a word, and it's important for everyone to understand how it impacts them in terms of where they feel it and what they think about it. But there are three types of stress. All stress is not bad. And so often we say, avoid stress, do this so you won't be stressed. And I think we really have to look at a different way of how we can optimize stress, dive deep into stress so that we can manage it. But there's eustress or positive stress. It helps us get on this call today, right? And then our bodies get back into balance. There's a tolerable stress where, we may be stressed, we may be feeling out of sorts, feel tense, feel like we can't focus. And then because of our resources, relationships, we're able to get back into balance. And then there's toxic stress. And unfortunately, that's where too many of us live, where it's relentless 24/7. Your brain is sending messages to every organ in your body to either turn off or turn on, which means if you have a chronic medical condition like diabetes, hypertension, it increases the risk of making that worse. It increases the risk of stroke, increases the risk of depression or anxiety. It really shuts down your immune system. So we know that the immune system can cause, if you have an autoimmune disease or if you have certain cancers, that can certainly be impacted. So chronic stress, that toxic stress, is something that we have to be aware of. And unfortunately, secondary to uncertainty, secondary to chronic racism, secondary to just the stress of life, so to speak, if we don't find ways to interrupt it in terms of working out, getting a good night's sleep, thinking positive thoughts, even going to a therapist sometimes, then it's just attacks your body, attacks your brain, and can cause serious medical conditions.
I really, really, really appreciate you sort of focusing on and expanding just the notion of stress. I think a lot of us aren't even conscious of the fact that that's happening. And so to call it out in the way that you just did and help us to sort of be more in touch with its potential impact is really, well, one, timely, but I very much appreciate it. And you had mentioned earlier, Dr. Janet, about racial discriminatory things having its impact. What is the effect of racialized trauma on us as individuals and in our organizations? I know our listeners would be interested in hearing a little bit more about that.
So as I heard Senator Warnock put this about, the twin pandemics of COVID-19 and COVID-16-19, which really ties in what most of us have been feeling the past 20 months. And that's the effect of the reality of COVID-19 and the uncertainty. And then for many people witnessing either, unfortunately, people in their family or loved ones or colleagues who were sick and maybe even died from that. So you have that aspect, and I'll talk about how the brain deals with uncertainty in a moment. But also we have, unfortunately, in this country, 400 years of a legacy of historical trauma and racial trauma. And that trauma resides in the brain and it causes chronic stressors. And so when you think about trying to run a company, trying to manage people, trying to manage yourself, the effect of trauma on the brain is it can impact focus, it can lead to depression or anxiety, it can cloud how we receive people and how they receive us. And so it's not something that just is in our head, it can manifest itself within our physical conditions. And it's really, really important that on top of recognizing the day-to-day stressors, that you realize Dr. David Williams from Harvard has done studies about the impact on Black people in particular when they witness, whether it's in real life or on television, an unarmed Black man or woman who gets killed by the police. And it can lead to increased sick days, depression, anxiety, and within the same community, not affect the white people. So racialized trauma has a real impact on our brain, on our functioning, can have long-lasting symptoms. So in our workplaces where we know racism exists, institutionalized racism, microaggressions, it's just another layer of trauma. So it's really, really critical that we use emotional intelligence, which means being self-aware about how we're feeling and thinking, socially aware of how we react to other people. And and it feels like too much, when we feel emotionally exhausted, we feel depleted before it gets to that point, that you take a breath and allow yourself to recover physically, recover emotionally, recover spiritually, because it's not made up what we're all going through. And certainly executives, even though they may, have great bank accounts, great access to things, your brain is still your brain. And so you are not immune to the day-to-day stressors that occur from trauma, and specifically racialized trauma.
Wow, thank you. I was particularly struck by the difference in Blacks having access to or pursuing mental health care in comparison to whites. And it opened this opportunity for me to ask you this question about, from your vantage point, what are some of the barriers to mental health care? Like, what barriers do you see that's out there?
Well, barriers to mental health care certainly are stigma, which creates a why try phenomenon, but that's not an accident. My friend Harriet Washington wrote an amazing book called Medical Apartheid, which details the long history of racism and bias in medicine. And so it's not an accident that when Black people are hesitant to talk about how we're feeling, to talk about our families, because for so long, just because of our Black skin, it's been, our thoughts and feelings have been used against us. And what we have to do, certainly as healthcare providers now, and that's not just for me, as a Black woman, but all of us, we have to re-engage people with a sense of trust and a sense of cultural understanding, cultural humility and competence, where we can acknowledge the trauma, we can acknowledge the barriers that happen when someone walks into our office, so that we can get them to come back. And so barriers to mental health treatment certainly are stigma, certainly are the long history of racism in medicine. We know even to this day, Black women will present to their primary care provider on average 10 times before that provider asks them how they are doing psychologically. So when you're in pain, psychic pain, physical pain, and the doctor or nurse practitioner or person you're seeing can't even see you, can't ask how you're doing, that's a barrier. And we also know that certainly in terms of, even with COVID-19, the number of people who are uninsured and underinsured, and what that means when you're going to go somewhere and maybe incur a bill that you can't afford to pay. So the lack of parity for mental health access in terms of reimbursement to insurance. And the reality is that Black people still are overdiagnosed as psychotic, versus maybe you're depressed and then have psychosis, or maybe bipolar. So it's not just us as a reason that we don't access mental health at the same number. Certainly women will access mental health as higher numbers, but my experience has been that more and more Black men are coming in for therapy, which is good, because the reality is, we all have something, and to the extent that we can deal with it in a way that just makes us better, helps us realize our potential, helps us realize our purpose, then we can continue to navigate what promises to be not smooth sailing, because life is not like that, but choppy waters. But then we have the tools, which is being able to understand and recognize when we need help, when we need to deal with our own mental health, so that we can get on with it and enjoy our lives the way we're supposed to.
Yeah. Dr. Janet, how do we eliminate the stigma associated with getting treatment for mental health issues?
To eliminate the stigma, we need to be open and transparent about it. We need people to talk about their own experience with mental health providers. I've been to therapy multiple times. I divorced now, certainly went then, and even before. And so when we have people talking about it and can just make it, normalize the fact that you need help, that certainly helps. And then to make it easier for people, and sometimes to go to where people are, so that they don't necessarily have to come find us. We can go to where they are, but telling our story about it and engaging people and also having teaching people about resources, where to go find it. Certainly with COVID-19, in terms of telehealth and telemedicine, people are able to access therapists and psychiatrists and social workers, psychologists of color in ways that they never were before. And that doesn't mean that you have to have someone who looks like you, same gender, same sexual orientation as you, to have a good therapeutic experience. You need someone competent, but for people who are accessing mental health for the first time, certainly they feel like they want somebody who looks like them. And that's still difficult, but you need someone who is compassionate and competent so that you can get the care that you need.
Thank you. You had mentioned something in passing us just a second or two ago about seeing Black males appear to be at least pursuing treatment in greater numbers, which you represented as a positive thing. On a brighter note, what are other positive trends in mental health, or what's working? I just want to focus on that too. Right?
What's working is we are talking more about it, and we're teaching our children at younger ages how to regulate their emotions and how to speak up when something is not going right with them. And I see that as a positive. And then the fact that there are more and more people of color who are going into positions to help people with their mental health. And certainly on social media, the number of young psychologists and social workers who are, using TikTok and things like that to convey messages, positive messages about seeking mental health treatment. So we're slowly pulling it out of the dark ages and saying, you know what? Again, your brain is in your body. Our mind, your brain is the biggest ally that you have during these difficult times, because our brain does not like uncertainty. And there is a lot of uncertainty going on right now. So when we can face facts about our health, face facts about, whether it's a relationship status or our financial situation, and really look at the reality of it and then come up with a plan, then we can improve our mental health. So there are a number of people who are talking about those and talking about mental health in a way that I had never seen before.
That's encouraging. Dr. Janet Taylor, I really appreciate you sharing your wisdom around this topic with us today. It is my hope that we all take time to assess our own mental health and well-being and get the help we need. Let us not be guilty of ignoring the signs of stress, as you mentioned, in our lives, and just hoping that things get better on its own. Let's, just be aware of these signs and to do what's necessary so that we may be the best version of ourselves, for ourselves and for those we love and serve. So for that, again, I thank you. I thank you very much for being here.
Thank you, Mike. I appreciate the opportunity.
And to our viewers, thank you for joining us, and stay tuned for details about our next ELC CEO LinkedIn chat in December. Take care.